Swaziland is among the highest countries in HIV prevalence. If you look at our sentinel surveillance reports, you find that it is actually stabilizing around above 30%. But we're no longer seeing an increase, which I think I can attribute that to the impact of our interventions and programs that we've put them in place. We adopted male circumcision as per the recommendation from UNAIDS and WHO. And as a country, we incorporated male circumcision under HIV prevention.
The combined prevention measures, which include treatment with ARVs, abstinence in the young age group using condoms, if coupled up with male circumcision, it goes a long way in reducing the transmission of HIV. Because scientifically, it has been proven that male circumcision reduces the chances of a male getting HIV from a female by about 60%. The work environment is a very good place to educate males and females about male circumcision. We are taking the window of opportunity to go there and give them information.
The ILO is one partner that is helping us to focus on workplace program and is actually training some of our people in the workplace and making sure that services reach most of the people at the workplace.
The information has had a very much big impact, because now we do have some of our employees going to circumcise. We do have some of them who would come to us and tell us that I'm sick, I'm HIV positive, and on this date and this date I'll go to hospital. It is just something that these people are now free to talk about. We were approached by ILO. Yes, they came to us and they gave us a proposal about their business. We went to their offices, they explained everything, and we felt that it would be fine if we let our employees go and learn about this thing, because because of this much problem that we have with the people not knowing much about the things, because most of them are not learned.
We went for a course. So before the course, I wasn't motivated. I had many questions, but after I went there, that's when I started to think that yes, I have to go for circumcision. It has changed my life, because now I know that if I'm engaged in sexual intercourse, I must make sure that I'm using a condom, because after circumcision, it doesn't mean that you don't have to use a condom.
It was difficult before. There was a lot of stigma, and the ILO has actually worked with the management within that workplace, so that now they no longer stigmatize people who are working there to say if they go to test and they come and say that they are HIV positive, now they are welcome. It has actually helped to increase people who currently know their HIV status.
I think us as the leaders, like the supervisors, the management, it is up to them to talk to the people. Those people are not supposed to be afraid of us.
In the communities now, you find that these employees who find at workplace, they also come from community settings. And when they've actually acquired information where they work, they would even share that information at home. They start dialogues from there, and discussions actually grow from there. And you find that that is how it has helped to reduce the stigma. It has helped to increase knowledge. It has helped to increase some behavior a little bit. But you can see that people now, they are consuming services that we provide. Everyone has a role to play in HIV.